Good morning. Thank you so much for joining us. I'm Ashley James from Good Morning Maryland from 4:30 to 7, and I'm here with Christina Penny, who is a physical therapist at Active Life, a GBMC affiliate. Thank you so much for joining us.
Good morning.
So we're chatting about sports injuries today. It's a pretty common time to hear about that, right? As we're moving from winter into spring, even though it feels like spring today.
Right. So most people are a little less active over the winter, and so as you transition to these spring sports, things tend to crop up that maybe you've had before. There's something new.
All right, so this is how it's going to work. This is a live question and answer session, so you can write in your questions. We're going to have Christina answer them for us. We had some questions sent in, so we'll start with those, but feel free to be interactive. We want this to be a time where you can get your questions answered. This is so easy and so fun. All right, so this was sent in by someone. He said, I exercise regularly, and I recently started running for a half hour a few times per week. My knees started to hurt, so I had x-rays done, and my doctor said my knees are fine. So no issues, but my knees continued to hurt. So I stopped running, and the pain subsided. I have never been a runner, but I thought this would be a fun challenge for myself. A friend suggested wearing a knee strap or a knee brace while I was running. Would you recommend this, or is this something I should just give up? Maybe running's not my thing.
So that's a really good question. First of all, I would say, absolutely not with a knee brace to start with. Probably taking a look at your mechanics as far as how you're running, right? So if you're a new runner, you're probably not running in the right form. So there's some modifications that we can make as far as changing your technique, where your foot placement is, maybe work on your hip strength.
Okay, there we are. Now we're back.
Yay.
All right, so we're sorry about that. So if you could just say that answer again, just in case people didn't hear the end of it. So we're talking about having some knee pain. There's nothing actually wrong with your knee from a doctor's perspective. Knee brace, knee strap, do any of those work?
So I would say definitely to start without the knee strap and to work on your run form as far as changing your mechanics. There's a lot of different pieces that you can work on as far as like foot placement or hip strength that can improve how you run so you're not having knee pain. So it's not necessarily giving up something that you want to challenge yourself with, it's just modifying it to make it better for you.
Okay. Speaking of running, I've heard some people say that your shoe matters when you run, the type of sneakers. Is that true? Is there anything to that?
It is true. So there's a lot of different shifting and changing with the thought of what shoe prescription should be. One place to look at is, does your shoe fit you as far as width-wise? When you take off your shoe and you step on that sole, is your foot coming off of the actual sole piece, right? If it's overfilling, then the shoe's actually too narrow for you. As far as kind of different things that people talk about, heel height and cushioned, you want to move towards a more less profile or lower shoe. But as far as like your control, that's going to depend on how you look like when you run yourself. And that's going to be something that physical therapists can look to see how your foot placement moves as you run.
Okay. Another question. Last spring, I suffered from tennis elbow from pitching to my kids as they prepared for softball and baseball. Is there a way to protect myself this year?
So that's an interesting question that someone asked. Typically, we don't see what we call tennis elbow in a thrower. So tennis elbow is typically pain in the outside of the elbow, where most of the time we'll see what people call medial epicondyle or golfer's elbow pain in throwers. So I'd be interested to see if he's actually having pain on the outside versus the inside of his elbow. But typically, to prevent these kind of issues, you want to do a nice warm-up, so kind of moving the arm, not throwing, but at least going through the throwing motion to warm up the shoulder. You can also do some gentle stretching of the wrist, okay, because those muscles actually attach up in the elbow, and that's what's causing that pain, is that they get pulled, and then just doing like a gentle wrist strengthening program.
Okay. About 12 years ago, someone said they ran their first half marathon. Since then, I've tried to get back into running, but it has not stuck? Do you have any suggestions about getting back into a routine? So a lot of running questions, and I think this is the time of year when it starts to get nice. You want to do something outdoors. So getting back into a running routine, do you have any advice?
There's a lot of advice for that. So first is kind of goal setting. You want to pick something that's important to you, whether that be, you want to lose 5 or 10 pounds, or maybe that you want to run a particular race, okay? So that's your big goal, and then maybe make smaller goals towards that. So if she wants to run a half marathon again, maybe sign up for a half marathon, probably sometime in the fall, and then have other races in the spring and summer to build up to it. Also, having a training program really helps. Personally, I use like Hal Higdon. They have a lot of different stuff as far as kind of 5Ks, half marathons, marathon training programs. There's also, 5K walking programs. So having a program does give you at least like a little check off of like, oh, this is what I did today. It takes the guesswork out of what you're doing. And then giving yourself a reward. Say if I did this, I get to go buy myself a new pair of running socks or something.
I like that. Okay, we have some questions coming in from Facebook Live. So are there some exercises that you can do to protect your knee and strengthen the muscle around it to prevent running injuries?
Yes, and so a lot of that is going to depend on where you're having knee pain, whether it's on the inside, the front, or the outside. Typically, we do a lot of hip strengthening. And you're going to see a lot of different stuff online as far as hip strengthening goes for squats and lunges, but it's all about form. Okay, so when you're doing those squats and your lunges, you want to watch your knee position, that it's not going past your toes when you're coming down. When you're going down into that squat or that lunge, is your knee falling in? So it's all about doing those strengthening exercises for the glutes and the thighs, but watching your knee form. And then again, with that, going back to that question about running form, you want to make those modifications on how you're actually running to prevent knee pain as well.
Yeah, we've been getting quite a few questions that have to do with the knees and running. Running is just tough on your knees, it sounds like, right?
Somewhat. If you don't have the proper strength in your glutes, if you're overstriding or you've got not great form, different stuff like that is going to play into knee pain with running.
Okay. Another question from Facebook Live. I have heard different opinions on whether stretching beforehand is more beneficial. This was another question we actually had too. So people want to know, and I've heard the same thing, that actually stretching was better after. Is it before and after? Is it before? Which is best?
It's definitely best after, right? Those muscles are nice and warm, they're loose and limber, they're ready to stretch, okay? If you don't have time to stretch afterwards, you can stretch before. Maybe try some dynamic stretching where you're doing kind of a lengthening and a shortening exercise. So sometimes people do those standing and kicks as a hamstring dynamic stretch because it gets those to move as they're warming up. But if you don't have time, always stretching beforehand works as well.
Okay. I need to get more active. Which exercise should I start with?
So that's a loaded question, and if you want to send me a personal message, I can give you my email and we can talk about it then. You really have to think about what's important to you. Do you like going to the gym? Do you not like going to the gym? Do you like being outside? Do you like group exercise? So I can't say, oh, you definitely need to go try this one thing. You need to find what's personal for you.
Gotcha. Yoga. Do you like it?
I like yoga.
You do?
I do.
Okay, so for people who like to do yoga at home, should they be worried? I mean, because yoga, you hear it's so great for you, but some of those stretches, you feel like you could pull something pretty easily doing it at home. Do you think yoga's best when it's done with an instructor, or is it fine to do it at home?
It's certainly fine to do it at home as long as you're listening to your body, right? So you want to kind of be in tune to, does this feel good? Does this not feel good? Ultimately, if anything's sharp or painful, back off. If it feels weird or uncomfortable, back off. And that's where if you're noticing, this isn't going so well, maybe a group exercise or a leaded class might be beneficial, at least to kind of get those little fine-tuned pieces and know, okay, yes, I am doing this right.
Gotcha. Now, some people are just joining us on there, so they may have not heard some of your answers from before. So we have another knee question.
Oh, man.
Okay. So the question is, if you had a knee injury in the past, what can you do to protect your knee when you're exercising?
So again, that's going to be very dependent on what type of exercise that they're talking about. So again, if you want to send me a personal message yourself about that, and I can answer that a little bit more in detail. It's hard to say like what specifically. You have to know like the aggravating and easing factors.
Gotcha. Okay. You hear a lot about concussions with kids in sports, especially right now. I feel like we're always talking about that. How is it decided when an athlete can return to the field?
So that's a good question. Typically, with a concussion protocol, you're going to look at different things as far as how their symptoms are. So different symptoms can be such as headaches, changes in vision, irritable mood, balance issues, coordination. And so it looks at how you progress through each phase. And ultimately, it's a kind of gradual return to sport where you start with those first couple of days of just rest. Okay, then you're reintroduced to school activities, then you're introduced into light cardio, then you're doing some skill work, and then like light practice, full practice, and then game situation. But it all depends on your symptom presentation, right? So if you try and do some light cardio one day, and at the end you're kind of going, yeah, I still feel a little headachy, and that tells you you're not quite ready for that next phase. So it's all about monitoring the symptom presentation.
Yeah, and of course adults can get concussions too while playing sports or working out. Do adults heal quicker, kids heal quicker when it comes to concussions and getting back to sports?
That's a good question. That is it depends on every different person. So no two concussions are going to be the same, okay? And no two heal rates are going to be the same. Some of those symptoms can be delayed in onset. So when, for example, when you see like a football player and they get their bell rung and they look like they're not sure, and they do the concussion protocol and they look okay, they don't put them back in the game situation because sometimes those symptoms can be delayed. Okay. And then the other thing is that, sometimes these symptoms can be persistent and chronic. They can last up to 3 months or more. And so it's not about if it's a child or an adult, it's how that brain is naturally going to heal.
Okay. I've suffered from plantar fasciitis for the past 2 years during the spring. Is there any way to prevent this? Is that pretty common?
Plantar fasciitis is actually pretty common in pretty much any sport, like running or soccer, lacrosse, anything where you're picking up and running. Again, that's going to be a little dependent on the person. You have to look at if you're shifting from doing no activity at all in the winter, doing like a full-on back to sport. Different things to look at would be some calf strength, calf flexibility, looking at like your foot strength because you actually have little muscles in your feet, so that plays a role into it, the flexibility of your foot, and then shoe wear actually does play into that a little bit.
Okay. And if you are just joining us, we want to welcome you in. I'm here with Christina Penny, a physical therapist at Active Life, a GBMC affiliate, and we want your questions, anything that has to do with sports injuries. She's here to answer. It makes things easy. We can have this conversation, and it's so many people at home or at work who have questions for you. So keep them coming in, and we will read them to Christina. All right, another question. My son is a runner, and every season it seems like he struggles with a hamstring injury. Is there anything I can do to prevent this?
Yes. And actually, hamstring issues they can tend to be chronic in nature, that you kind of flare them up fairly often. That can be from two different causes. One's a kind of an acute injury. You have like that new pull, and then the other is a chronic where you have like those micro tears or micro injuries that kind of build up on themselves. So when you're rehabbing the hamstring issue, the first thing to think about is giving it some rest. And then you want to go into different phases of strengthening. So starting off with some isometrics, which is basically just like gentle strengthening without motion. Then you're going to progress into some concentric, which is strengthening in a full motion, and then eccentrics, which is strengthening against gravity. And because the hamstring is what we call the two joint muscle, it actually crosses over your hip and your knee, so you need to be doing exercises that move both areas in order to strengthen the hamstring. A lot of people kind of give up early on, like through the progression. It's like, oh, well, it feels good, and I think I'm fine. But if you don't go through the full strengthening program, you're actually kind of setting yourself up to have more hamstring issues later. So really working at that hamstring as far as, eccentric exercise and plyometrics and different stuff like that.
Okay. Another question from Facebook. I have a partial tear in my ACL, but she wants to play tennis. How to protect herself?
Okay. So it's going to depend on the grade of the tear, if it's a grade 1, a 2, or a 3. People can do well with a partial tear and still, play. It's going to be about adding stability at the hip and the knee, and say you can control that motion, especially when you're cutting. You don't want to let that knee kind of fall in because it can allow to a little bit more tearing. For her, a knee brace might be beneficial in her case, right? If you're working about that stability of the actual knee and the ligament itself. But she would benefit from some physical therapy, right? Just making sure that she's able to land and cut and turn properly, that she's got that stability in her hip and her quad so that she can control that motion.
So when do you know it's time to go to physical therapy? And then to follow up on that question, if you were, let's say, having some neck pain or some upper back pain from an injury, chiropractor, physical therapist, doctor, how do you know what the first step is?
So that's a really good question. So physical therapy is actually a direct access practice in Maryland, which means that you can see a physical therapist without going to see the doctor first. Now you do need to check with your insurance company because they may not cover that. You may need the referral firsthand.
Okay.
But unless you're having severe symptoms, like you're having numbness or tingling or weakness in an extremity, or you're having some unusual signs and symptoms, such as like changes in vision, then give physical therapy a try first. I always try and say, within that first 1 to 2 week window is a really good time to come to therapy when you're starting to have those symptoms. We can avoid progression into like those chronic phases where it's a little bit harder to heal.
Gotcha. Okay. I think I'm seeing some up here comments that I can't see on my phone, so I want to read them. What core strengthening exercises do you suggest to increase my running speed?
Okay. That is a good one. So I would love that person to send me a personal message because there's a lot of different core stuff that's out there.
Okay.
I really like planks, front planks and side planks. And
of course you do because they're so hard.
They're hard for a reason. So there's a lot of different fun, dynamic stuff that you can add with planks as far as kind of, doing some side planks and doing leg motions that are going to build in that whole like lateral chain to where you're working the core strength here and at your hip. There's so much out there that you really have to be a little tailored with that one.
We've had a couple questions come in about this. Heat or ice, which is better? When do you use either one?
Okay, so with the injury, within the first 48-hour window, you always want to use ice just to reduce on that inflammation and initial injury. After that, it's going to depend on what feels good for you, right? If it feels like ice helps, use ice. If it feels like it helps, use heat. Generally speaking, if you're working on swelling, though, you do want to use ice. Some ice and some elevation up above the heart is probably the best bet.
Okay, how long should you keep the ice on?
No more than 20 minutes.
Okay.
And you always keep something in between your skin and the ice pack. You don't want to get any freezer burns. But yeah, no more than 20 minutes on. You could do 20 minutes off a couple times.
Okay. Good tip there. What are your thoughts on cortisone injections? I've been struggling with pain in my heel for a few months. A friend recommended I go see the doctor for an injection, but I'm just not so sure.
So, good question. Typically with cortisone injections, we try to hold off as long as we can, right? You want to do those conservative efforts first, such as physical therapy, before you put a cortisone into an area, especially if you're talking about heel pain, elbow pain. There's tendons there, and tendons actually have been shown to weaken with cortisone injections, right? So you don't want to introduce something unless it's necessary.
Okay. For weightlifters out there, any tips for them? Weight belt, should they be taking all the precautions?
It depends on how heavy you're getting,
Okay.
And it really depends on your experience. If you're new to the game, you probably shouldn't be lifting enough that you need a weight belt. Probably need a little bit of guided exercise as far as your form and your technique. As far as high level, that may be a better question for their conditioning coach.
Okay. A question from Facebook. Is physical therapy helpful for old injuries?
Yes. Oh my goodness. It's great for old injuries. Just because it's old doesn't mean that there's not a reason that it's happening. Okay. So we can really delve down into what are the specific areas that seem to be contributing to the symptoms, whether that be, you've got some spinal input, you've got some soft tissue issues, you've got some chronic weakness on that side. People do really well with chronic injuries.
I pitch in a co-ed softball league, and last season I noticed my shoulder was really sore at the end of the season. I'm worried about this spring coming up. How do I know if I have a rotator cuff tear?
Good question. So rotator cuff tear is actually pretty specific. There's a couple of different tests that we can do to look if it's actually torn. One is muscle strength testing. Do we see, are you really weak when we test that shoulder strength? Is it weak and painful? There's something called a drop arm sign where you raise your arm up and you drop it down and you can't control it and it actually really hurts. That's a good indicator that you have a rotator cuff tear. That would be some places that I would start.
Okay. Is there one sport more than others that you see more injuries from?
Well, personally, I've been trying to work up seeing a lot of runners, so I've seen a lot of runner injuries. But not any one specific sport. They all kind of tend to have some injuries.
Okay. How long does physical therapy usually last when you come in? What's a typical plan? I mean, are you there? Do you expect to go into physical therapy for weeks, for months?
This can be tailored to each individual. Typically what we do is probably a 4 to 6 week course management, once or twice a week. Again, it really is going to depend on kind of how each person presents, and how well you progress in that program and how well we can get you back into your sport.
Okay. With injuries, massages, beneficial or could they do more damage?
That's a good question. Massage is good as long as you're not overdoing it. Some people can really get in there and kind of overdig. If the massage is painful, it might not be so great.
Good to know, because I always thought the more painful, when I'm in a massage, I'm thinking, I think this is helping. I think this is not, maybe it's hurting.
Right? I mean, as long as it's guided under professional. So a physical therapist, if I'm getting in there and I'm causing some pain, but afterwards we can retest something like, if this hurts and it hurts when I raise my arm, if I do massage and I can move it better afterwards, then yes, that it is beneficial. But the whole no pain gain thing isn't always applicable to everything. So with massage, it's really finding, is that tissue really restricted? And is it really contributing to your symptoms?
Okay. All right. Well, we have answered all of our questions, and so we want to thank you so much for being with us. And
thank you for
is there
having me.
anything else that you would like to share that we didn't cover that maybe you want to get out there?
I guess just, if you have an injury, don't wait. Don't wait on it. First week or two, if you're like, man, it isn't getting better on its own, try physical therapy out. There's no point in continuing with an injury. You don't want to progress it into a chronic state. And the sooner we address those injuries, the sooner you're going to get back to sport.
So you would say, wait, how long should you wait? Just about a week or two, not too long?
Not too long.
Okay.
Yeah.
Good tips. Well, thank you so much.
Yeah, thank you.
Loved having you here, and thank you so much for tuning in. You can continue to ask questions, and we hope to see you back again. Thanks so much.
Yeah, thank you.
All right, take care. Have a great day.